Hello friends, and welcome back to my channel. Welcome back to the second part of the management of the patient. So let's continue wherever we have left off. Let's see our next patient. So next patient says about a 15-year-old developed the leg, occasionally has skin yellowing, spleen is very enlarged. These dimension of the spleen are already for the splenectomy. Sir, why splenectomy? Just a moment. So cholelithiasis is there, skin ulcer of the lower third areas, RBCs are low, hemoglobin is low, color index is fine. The more findings are there, total bilirubin unconjugated. I'll explain all of these findings to you in the hematological values. Just for remembering here the very well, we got what we needed in the question. This is RBC destruction and hemoglobin levels are reduced in the patient. Sir, where the RBCs are getting destructed? Sir, the size of the spleen, just have a look over the dimension of the spleen. It should be a very small organ, and the size is saying, just look at the size, it's in centimeters. So sir, if the size of the spleen is increased this much, it is destructing the RBCs or our blood more than the norms. So the overproduction is not good, the over destruction is not good. So guys, cut that organ which is causing the over destruction of the RBCs in this case. Yeah. Spleen dimensions are given very well. It should be near to the level of navel already, or maybe below it even. Do the splenectomy. What benefit we will get from the splenectomy? Yes, there will be some side effects of splenectomy, but if the RBCs are getting destructed, what can be more complicated than this thing? Yeah. So sir, RBCs we cannot see getting destructed anymore, so we will cut the spleen so that there will be no more destruction of RBC in the patient. So let's see, our next beautiful patient is with the status epilepticus. Sir, what is status epilepticus? So I have highlighted in the video over status epilepticus specially as well. So sir, status epilepticus is something, the patient doesn't regain the consciousness between two seizures. The patient is having seizures and the patient does not get back to the consciousness in the break between the two seizures. So sir, management, we are talking about management here. Tell us about the management only. So sir, we will ensure that the airway is open and the patient is breathing. So if the patient is breathing, we are already preventing some complication in the patient. So this is the management related to status epilepticus, that perform triple maneuver or do whatever you can, that just ensure the patency of the airways and make sure the patient is breathing. Sir, next is Horner syndrome. So Horner syndrome, I have explained it in my first video of the channel with the photos. So Horner syndrome is a problem with the sympathetic supply of the patient. So if the sympathetic supply is going to get reduced, sir, what we are going to see in the patient? Sir, first of all, eye muscle is very small. We'll see drooping eyelid, ptosis, meiosis, all of these things in the patient. And so brain CT is normal, right-sided ataxia, which is coordination problem, loss of pain sensation in his face on the right, and this. So we suspect some blockage, isn't it? So some blockage is there. That's why, sir, the patient's sympathetic supply got reduced. So, sir, in order to correct the clot or the blockage, what we will do? We will introduce the direct anticoagulants and observe the patient. If the patient doesn't improve his condition by the introduction of anticoagulants, we will do what is needed the next. But first of all, the primary management is prescribe the anticoagulants and act according to the condition in the monitoring section. So let's see next patient. Oh god, this is atypical question. Me and my friend keeps on fighting over lidocaine and amiodarone. and we are still not sure. So let's hear to the patient first. This is the case of acute myocardial infarction. 4 hours ago, ECG shows short paroxysmal ventricular tachycardia. So I have explained you the ventricular tachycardia in the different video, so watch the video or short video over it. So this is the case of paroxysmal ventricular tachycardia. So what we need to do, we will provide the antiarrhythmic drugs to the patient. So antiarrhythmic drugs are used for the acute setting of the ventricular arrhythmias, especially after the post MI. So this is the class 1. So sir, lidocaine or amiodarone, tell us finally. So you tell me in the comments that you are seeing at the question of test center right now, what they are using right now. This is a very old question. I will have more question over this, and the problem in this case is lidocaine and amiodarone both are fine for the patient. When we cannot use amiodarone, we go with the lidocaine. Yeah, but nowadays in the new questions they are preferring the amiodarone. So do not have to mark lidocaine. This is old treatment. The KROK itself has changed its treatment. So you have to remember that in the cases of paroxysmal ventricular tachycardia, what you will prescribe to the patient, amiodarone. Go with the amiodarone if it is given in the question, in the option. If the amiodarone is not given in the option, then go with the lidocaine. So in the cases when we cannot prescribe amiodarone due to some contraindications, we are going to prescribe lidocaine to the patient. But remember, first line treatment for the paroxysmal ventricular tachycardia is amiodarone. Next patient says about the cardiac glycoside overdose. Patient who take diuretic has arrhythmia as a result of cardiac glycoside overdose. Sir, what is the treatment for the cardiac glycoside overdose? So remember that potassium is the antagonist for the cardiac glycoside overdose. So if you will increase the potassium concentration in the blood, the effect of cardiac glycoside overdose is going to get normalize in the patient. So there was some translation error in the question, and so try to remember it that this D was not given in the question. This D was not there in the option. This is something we have to consider. So increased potassium concentration in the blood, this is what you have to mark as the answer for the KROK question. However, the option will say increased potassium concentration in blood. So this increased, so you will remember it, I hope, guys. When the question says about cardiac glycoside overdose, just prescribe the K antagonist or increase the potassium concentration in the blood and move on. Let's see our next patient. Next patient says that patient with the history of hepatitis B during the last 5 years, the source of bleeding is esophageal vein. He got a hemorrhagic shock or due to gastric bleeding. So source of bleeding is esophageal vein. To control bleeding. So what we are going to do to control the bleeding? So in the first video, I have shown the introduction of obturator nasogastric tube. You can must watch over there. We are going to introduce a nasogastric tube to the through the esophagus of the patient and inflate the balloon so that the bleeding could be stopped. So this is the best choice of treatment here. So what tube we are going to insert is here is the tube. Said that this tube we are going to use. This is known as Minnesota tube and Sengstaken tube. So no need to remember it. It was never given in some question of the KROK. I just did it for my personal interest. I wrote it here, which is that obturator NG tube which we are going to introduce in the patient. So sir, we in the cases of esophageal varices bleeding, we know from now that we are going to introduce a obturator nasogastric tube and inflate the balloon so that the bleeding can be paused finally. Patient 22-year-old has a closed fracture of malleolus. So closed fracture of malleolus is related to the fit portion of the or the ankle portion of the foot. So without displacement, which position foot has to be fixed? So we are going to put a plaster cast. So a plaster cast in order to correct the fracture of the malleolus. So in which position has to be plastered? So sir, malleolus, the feet should remain, the shin should remain on the angle of 90 degrees to the foot. Here I have drawn it so that you remember. So at the right angle, or from the 90-degree angle, with the varus positioning of the feet. Varus positioning means the feet lies on the ground, straight erect position, and the shin is shin or the leg is just perpendicular to the feet portion of the patient. So we are going to apply the cast on the right angle with varus positioning, which is inward tilt of the patient. So next case is about the acute pneumonia, respiratory failure second degree, and malnutrition second degree. So what combination of medicines or drugs we are going to provide to the patient, so that all of this much of problems the patient is having? It's just a 7-month-old infant and this much of the problems. So we cannot give a lot of pills to the patient, like especially for pneumonia we will give another pill, respiratory failure another pill, malnutrition a lot of another pills. So we cannot give some 5-7 pills together to the patient, but we have a choice nowadays. The pills are available in the mixed form. So here is, just read it for yourself: MPOX and amikacins. Let's see what are the mixtures, what are they. So sir, the patient is having acute pneumonia. The patient is having acute pneumonia. So what we are going to prescribe to the patient? We are going to prescribe ampicillin plus oxacillin. MPOX is first. So this is one of the thing, broad spectrum gram positive and gram negative antibiotic. So ampicillin plus oxacillin is the mixture here in MPOX. So sir, gram positive and gram negative bacteria, all of the bacteria will be dying through this amikacin. So amikacin is a gram negative, especially for the respiratory infection antibiotic. So you will remember from now this question, guys, that acute pneumonia, respiratory failure degree 2, malnutrition of degree 3. So if the diagnosis is malnutrition of second degree, you are going to prescribe to the patient MPOX and amikacin, which are full of antibiotic properties. Next patient says about the child night hungry abdominal pains, fibroscopy findings in the areas of bulbous of duodenum, the ulcerative defect 4 mm, floor is obstructed with the fibrin, H. pylori positive treatment. So this is the case of ulcerative defect, is the case of ulcer. This is the case of duodenum ulcer. Yeah. So in the cases of ulcers, we are going to provide the triple therapy to the patient. Triple therapy is omeprazole, or in Poland proprazole, which will decrease the secretion of the acid, and trichopolam. Sir, this is metronidazole, in order to make sure the infection will get treated properly. The clarithromycin for H. pylori especially. So this is the triple therapy which we are going to use: omeprazole, clarithromycin, trichopolam. Sir, in the cases of peptic ulcer, you will see another question over there, in which only omeprazole and clarithromycin were given in the question. So triple therapy or drug therapy, whichever will be according to the question, you can mark just 3 of them. If the question is given and the option is only omeprazole or clarithromycin, then go with that option. That option is correct too. If the metronidazole is not given in all the options, so no problem is there. Trichopolam may not be in option always. So next case we have discussed patient number 53. So we have discussed in the pneumonia part as well, but let's see it one more time here, that the patient is having brown sputum. The sputum is really brown here. Treated in hospital, got the profile of pneumonia. So sir, this is the case of hospital acquired pneumonia, and the drug of choice in KROK for the hospital acquired pneumonia is cephalosporin 3rd generation. So this is something to remember, and for the good explanation, watch my video over pneumonia. Next is the patient related to schizophrenia. I have explained the schizophrenia and the treatment very well, so watch the video over schizophrenia. But remember again that suppurative treatment with neuroleptics which we are going to provide. So neuroleptics is if we provide to the patient of prolonged action, so this is something as a treatment of the schizophrenia. Next is mercury poisoning. So we all know in the cases of, this is a question from KROK-1, that in the cases of mercury poisoning we are going to provide unithiol to the patient, which is a chelating agent which will bind with the heavy metal like mercury. So this is the case of chronic mercury poisoning. The treatment which eliminates the mercury is unithiol. Sir, next is the case of enlarged prostate. So prostate hyperplasia or hypertension are noted in the patient. So, sir, the BP is also high, and the patient is having benign prostate hyperplasia as well. So remember guys, something to remember, that the problem related to benign prostate hyperplasia and hypertension. So doxazosin is the drug of choice. So remember, you know how to remember it, that if the patient is having benign prostate hyperplasia, the name of the medicine starts with the D. So you know how to remember it, right? So sir, we are going to prescribe doxazosin for the prevention, or for let's say for the management of hypertension plus the enlarged prostate gland. So remember, the medication name starts with the D. You know how to remember it. Let's see the next patient. Next patient says about the 19-year-old having emergency department, unconscious stage, pulse is high, cyanosis, myotic pupil, superficial breathing 12 per minute. So the breathing is 12 per minute and BP is severely low. Sir, breathing 12 is the terminal, or let's say the lowest ranges of the norms. So control the respiration. So pulmo and cardio system works together. The pulmo system is not able to breathe, so the cardio system is not able to pump anymore. Yeah, the grave condition of the patient are explained in this question. So first of all, what we need to do is, sir, correct the breathing so that the patient can come back to the consciousness finally, and the correct measures can be taken for the further monitoring of the patient. Let's see our next patient. Next patient says, patient number 58. Patient says that he is having hypertension from 20 years, frequent headaches, dizziness. He is taking AC inhibitor as enalapril. So objectively, the accentuated S2 above aorta. So what it means, guys? It means the aortic hypertension. And if the S2 is accentuated over the pulmonary artery, it means the pulmonary hypertension, that more blood flow is over there. So pulse is high, rhythmic, arterial pressure is still high. The patient is already taking the AC inhibitor, but the arterial pressure is still high, which means the poor control of the drug. So what we are going to give as a combination, we are going to prescribe the thiazide diuretic to the patient in order to control the hypertension in better way. Let's see our next patient. Patient 59, 10-year-old having hemophilia. Hemophilia means uncontrolled bleeding is there in the patient. The risk of acute respiratory viral infection with fever and antifebrile medicine. Which medicine is contraindicated in the patient? So remember, guys, aspirin should be contraindicated in the patients of hemophilia because it will increase the risk of bleeding. So do not prescribe acetyl salicylic acid to the patients of hemophilia. Let's see the next patient. Next patient says that thermal burns he got, and 3A and 3B degrees. That amount of 20% of the total skin covered. 20% is the amount of total skin covered. Arterial pressure is this, heart rate is this. What transfusion measures should be used for the blind transfusion during the transportation? So, sir, already infused the salines to the patient in order to prevent the hypovolemic shock here. Sir, what are the main salines which we are going to inject in the patient? So in the ambulance, or until the patient is getting transported to the hospital, sir, prescribe the salines to the patient, which is normal salines or ringer lactate you can prefer to prevent the hypovolemic shock due to burns. So the patient is getting burned, so he would have lost some volume of the blood. So in order to prevent the hypovolemic shock, we are going to prescribe salines to the patient. Let's see the next patient. Next patient complains about the multiple sclerosis. I have covered this, what is this and how is this. So this is an autoimmune condition. So you can watch my video over the neurodegenerative disorders. Multiple sclerosis having neurodegenerative disorders. So this is immune mediated, yeah. So immune reaction. So what we are going to prescribe in the patient, sir, we are going to give immune suppression to the patient. So a problem is going to get solved from the patient. So sir, we are going to prescribe glucocorticoids. One of the glucocorticoid is methylprednisolone. So methylprednisolone will suppress the immune system, and the problem is going to get solved. Next patient is having right-sided trifacial neuralgia. Sir, this is chronic pain and shock-like condition of the patient. So remember about the drug of choice for the right-sided trifacial neuralgia. The drug of choice is finlapsin. So remember about it, that finlapsin. One of the finlapsin is given here. Next patient says about the otitis media. He had a patient with the otitis media complicated by mastoiditis and shadowing of the cellular system, absence of the bone septa. Necessary therapeutic action should be taken at the second stage of the mastoiditis. Sir, mastoiditis is a complication of otitis media. So mastoid process is just behind the otitis part in ear, or just behind the ears. So it's very easy spread of the infection from the otitis media. The infection can easily spread to the mastoid process. At the second stage of mastoiditis, what you are going to do, sir, cut the mastoid process in order to prevent more further complication to the patient. So we are having no problems after doing mastoidectomy. So the patient will be able to live normal life without further complications. So next patient 73, I have explained it already, that in the meningococcemia, when toxic shock of first degree is there, so you are going to prescribe the chloramphenicol succinate and prednisolone, which are chloramphenicol succinate, which is a powerful antibiotics, 2 to 3x powerful than the normal antibiotics. Next patient says there is a big crushed wound on his left thigh 4 hours after trauma. Prevention of the gaseous gangrene. So sir, gangrene we want to prevent this time. So what you will do, you will just remove the necrotic tissues, timely surgical processing of the wound. So sir, if we will monitor the patient well, then we can prevent the gaseous gangrene, right? So remove the necrotic tissues time to time, and after removing the necrotic tissues, you can prevent the gaseous gangrene. However, further risk of complication is over there, but if you will do the monitoring part very well for the patient and surgical processing of the wound, the patient will be able to get prevention of gaseous gangrene. Next patient says about the acute MI complicated with the cardiogenic shock. Later is progressing under the condition weak general peripheral resistance, so a decreased cardiac output. Sir, the patient is having low cardiac output. So if we will provide dopamine to the patient, so the patient is prone to the cardiogenic shock, and so if we will prescribe dopamine to the patient, it will increase or it will improve the cardiac output, since it is a stimulator for the sympathetic system. So if sympathetic system will improve through dopamine, or the mood of the patient improves with the sympathetic system as well, so dopamine can be provided to the patient in order to improve the cardiac output and remove the or reduce the peripheral resistance or vascular resistance in the patient. So remember about dopamine, you can provide dopamine to the patient in order to improve his cardiac output. Next patient, the furuncle is there at the pleural necrotic stage. The furuncle was lanced at the hydration stage. Sir, hydration state of the furuncle is given here in the question. So if you will just put the hypertonic solution over the furuncle, so the hypertonic solution when you will apply over some hydrated part, so it is going to suck the moisture from the wound. So the phenomena of osmosis osmosis or diffusion, whatever it will occur there, probably osmosis. The passive movement, osmosis, will occur over there, and the hydration of the furuncle, the hydration is going to get reduced, and this is something good for the patient to do here, hypertonic solution. Next patient says about the skin affection, body, face, extremities turned up after the perioral intake of biceptol. Diagnosis is drug intoxication. So what you are going to prescribe in the cases of drug intoxication? So drug intoxication or drug toxicoderma. Toxicoderma means skin changes which are drug induced. So the patient took some pill, and after that he saw some skin changes over there. So a drug induced skin infection. So in such cases we are going to do extracorporeal therapy, which simply means remove the drug from the bloodstream of the patient before the patient will get a hypovolemic shock, or let's say anaphylactic shock, or any more severe skin allergy, or any more complications. So we just remove the drug from the bloodstream of the patient. So next is a third degree burn case. Total area covered is 20%, arterial pressure is very low. So this is a shock. The arterial pressure is in the ranges of shock. So what you are going to do, sir? We are going to do the shock management. So injection of narcolytic analgesic, because the patient is in pain. With the third degree burn, it will be so painful. Howsoever, the burn receptors, after the stages of 3 degree or more stages, the receptors will also burn. So the patient's pain will reduce in more severe cases of burn. So we are going to prescribe narcotic analgesics to the patient in order to reduce the pain, and powdered blood substitutes in order to do the shock management. So powdered blood substitute will be able to manage the shock in this patient. Here are the analgesics. Analgesics are painkillers. Next patient says about the endometrioid cyst. So how you will remove the cyst, sir? Cyst can be removed surgically only. Howsoever, in some cases we have seen that cyst can be treated by pills, or maybe not. Cyst, do with the surgical laparoscopy, remove the cyst, and this is the best good treatment for the cyst. Patient number 60. So this is the case of color index more than 1. So this is the case of vitamin B12 deficiency. As you can see that physical findings which we discussed in the anemia portion, tongue is crimson. So crimson tongue is the character of vitamin B12. Remember from this question that jolly bodies is also seen in vitamin B12 deficiency anemia. So what you are going to prescribe to the patient? So sir, vitamin B12, if you prescribe to the patient, the problem can be solved. Next case is again the case of PVT. Sir, what you are going to mark in the KROK question nowadays the treatment is amiodarone. So remember about it. Next, the preparations used for fungal infection. So we have discussed it already, that fluconazole, fungal infection, F for fungal, F for fluconazole. So remember about this option. Let me tell you a little bit detail here, that fluconazole is the prevention for the candidosis, and orungol is the prevention or the solution for the systemic illness associated with the fungal infection, and nisoral is something related to the candida as well. So let's see the next patient. Next patient is diagnosed with the cervical insufficiency. We have discussed it, that place a suture over the uterus. Next patient says about the clotted hemothorax. Sir, hemothorax or pneumothorax or anything which is there. So if the fluid filled thing is there, so how you will do? So surgical removal of the clotted hemothorax and drain the pleural cavity well. Next patient says about the primigravida, headache, nausea, pain in epigastrium. Objectively, the skin of the patient is acyanotic, face is hypertrophic, short, fibrillar, twitching of the this and this muscle. Her look is flexed. So sir, what the question want to highlight by saying that her look is flexed? Sir, this can be the case of seizures, that her look is flexed, she is not even blinking her eyes. So this could be a type of seizure measures. Arterial pressure is significant for preeclampsia or eclampsia. So the patient's conditions are grave. Respiration is high, heart is rhythmic, appreciated edema or edemata of inferior extremities. Sir, heart failure sign. This is heart failure sign that the edema of the extremity is present. So a problem could be with the some ventricular failure. So urine is cloudy. Sir, what does it mean by cloudy urine? Sir, proteinuria is there. So this is the case related to the eclampsia probably. Sir, what we are going to provide to the patient? I don't know if it is the choice of drug here, but remember for the KROK question, what we are providing to the patient, this is droperidolum, 0.25% to 2 ml infusion to the patient in the initial stages. So sir, what is this medication? Sir, this medication is a sedative agent which will relax the patient. So probably it's for the betterment of the patient. So probably it's gonna help the patient. So this is antipsychotic, antiemetic and sedative. Since in the pregnancy cases the vomiting is so severe in the patient, so in order to relieve the vomiting, so this is droperidolum, antipsychotic, antiemetic and sedating agent. Next question, next patient says about what? Next patient says edema face, legs and raise of the BP. She fell ill after recovering from angina. Proteinuria is there. Erythrocytes are there in the urinalysis and leukocytes are there, erythrocytes are there. Sir, this is the case of glomerulonephritis. Sir, which kind of glomerulonephritis? Sir, post streptococcal glomerulonephritis. She fell ill after recovering from angina. Howsoever, the tonsillitis is not given in the question, but remember in the cases of post streptococcal glomerulonephritis, the question will tell this to you that the patient had upper respiratory tract infection or tonsillitis a week ago or two, and now the patient got developed with the urine analysis. So urinary problem when there, so suspect that kidney function got failed or reduced. So in the cases of glomerulonephritis, what we see in the patient, proteinuria, RBCs are loosening up because the kidney is not able to filter them well and reinfuse them to the afferent, from the afferent to the efferent arteriole from the Bowman's capsule. So treatment, sir, what you will give to the patient? We will prescribe the penicillin OS to the patient. This will solve our post streptococcal glomerulonephritis. However, maybe it's not the treatment of choice here. Maybe sometimes if it is autoimmune, we need to give the immune suppression. But remember for this question that in this case we are providing the penicillin OS. Next is 87th patient, a 52-year-old having what? Diagnosis thrombocytopenic purpura. Sir, you did not make a video about the thrombocytopenic purpura. So let's hear it in this portion itself. This is very easy. No need to mug up with meningococcal infection or anything else. Sir, what are the hallmark findings of thrombocytopenic purpura? So the hallmark findings are the dotted hemorrhagic rash over the torso part. Search a photo over Google right now with my voice itself, that the patient will be having a lot of dotted hemorrhages on the torso or on the leg portion, and the question will say this to you very well. And also plus thrombocytopenia. So dotted hemorrhages on the torso part of the patient and thrombocytopenia. So what is the normal level of thrombocytes in the patient? So the normal level of platelets in the patient should be around 150 to 400 number something. So this should be the normal ranges. So below 150 platelets when we see in the question and plus dotted hemorrhage when we will see in the question, we are going to mark the thrombocytopenic purpura. However, if something comes complicated, I'll let you know in the comment section, or if there is any new question. So sir, let's see the case profile now. So 52-year-old patient complains about the hemorrhagic diathesis of the mucous membrane, massive skin hemorrhages in the form of ecchymosis. So remember, ecchymosis is easy bruising of the skin, guys. So easy peeling. This is also a hallmark finding for thrombocytopenia. However, this is associated with other condition as well. This can be in the cases of other things as well. Sports, nasal and stomachal hemorrhages. So hemorrhages are there. Sometimes the patient will also complains about the nosebleeds. Diagnosis, the doctor will which has made here is thrombocytopenic purpura. So what is the cause of this condition? So this is an autoimmune condition. So the generation of anti-thrombolytic antibodies. Sir, thrombocytopenic purpura is an autoimmune condition in which our immune system makes antibodies against our native thrombocytes or native platelets. So it is going to destruct the platelets or thrombocytes in our body. So we will see such and such patient in the symptoms in the patient. Sir, diabetes type 2, next case. Diabetes type 2, sir, administered dietotherapy. So if the stage of the diabetes mellitus type 2 is fine or is mild here, so we can cure or we can keep the patient better with the exercise and diet therapy, probably in the questions of diabetes type 2. So diabetes type 1 is autoimmune process which will occur in the children. I have explained everything in the diabetic portion. You can watch that short video over diabetes. However, in the diabetes type 1, the patient has to take regular insulin injections because there is no more production of the insulin is there. So in the cases of diabetes type 2, the pancreas or the pancreas releases insulin still, but not in the sufficient amount so that it can meet the body demands for the insulin. So sir, what we are going to do, sir, if we'll take good diet, if we will do exercise well, so our pancreas, or what is the benefit of the physical activity, that all of our endocrine system are going to get improved. However, you know about the other benefits of the physical activity as well, but the main thing, key point here in this question is, if you will give the exercise or diet therapy to the patient, his endocrine function or exocrine function of the pancreas will improve, all the endocrine system in the body will improve, and the patient will be able to process the blood sugar better way. So next patient says that 15 minutes after the second vaccination with diphtheria, tetanus toxoid and pertussis vaccine, 4-month-old boy manifested with symptoms this and this. Quincke edema. The case of quincke edema, you can see the photo of quincke edema in my first video. The emergency aid which should be provided to the patient. So the emergency aid, quincke edema, is the rapid swelling of the deeper layer of the skin, face, lips, throats and extremities. The patient will look very funny to you probably, because if you will see the photo in my first video, so you will see the lips of the patient got this much swollen. It may look funny for us, but let's say the main key point to highlight here is quincke edema. What we are going to prescribe to the patient, quincke edema is a emergency condition. Sir, if we prescribe emergency aid prednisolone, then it is going to get cured. So quincke edema, since you know that this is an allergic reaction, or let's say anaphylaxis or angioedema, so this is immune mediated. Sir, we need to suppress the immune in order to prevent further deterioration of the patient. So we are going to prescribe prednisolone in the cases of quincke edema. Next patient number 90 says about the cosmol respiration is there, smell of acetone is there, symptoms of peritoneal irritation are present, blood sugar is there. So the patient is the case of diabetic ketoacidosis. You can see in the diabetic portion very well. So the case of diabetic ketoacidosis, and the patient is showing the positive symptom of peritoneal irritation. So no matter what, if the symptoms of peritoneal irritation are there, so you have to go with the surgery, like the immediate surgery. So sir, what we are going to prescribe to the patient with the diabetic ketoacidosis here, sir, prescribe the short acting insulin, so that it will due to the blood loss during the surgical process for the peritoneal surgery, the patient will not going to meet the complications, so prescribe the short acting insulin. Next patient says about the 55-year-old suddenly ill, skin pale, autonomous respiration was absent, pulse on the carotid arteries couldn't be felt. Sir, this is the case of pupils are this and this, action should be taken being the cardiac resuscitation. Sir, you can do other measures as well, but if the option is given pericardial thump to you, howsoever this is very old treatment or very old management of the patient, but however in the KROK questions, what what you have to remember is that if the pericardial thump is given in the option, then this is the case of cardiac arrest. So if the patient this option is given, so you are going to mark the pericardial thump, that thump the patient of the cardiac region of the patient, which we are supposed to see that the patient's condition is going to get improved. So next patient is having what, the acute respiratory failure and collapse of the left lung, injured during so they were performing the esophagogastroduodenoscopy or whatever endoscopic tube insertion, so resulted in the acute respiratory failure and collapse of lung. Sir, while they were inserting this endoscopic tube to the patient, what would have got happened, there is some injury got occurred in the respiratory system of the patient. So what you are going to do in this case, sir, we will drain the pleural cavity by Bullock's method and antibacterial therapy. Sir, what is Bullock's method? We never heard about it. Sir, Bullock's method states that we are going to use some trocar. You have seen this trocar in the cases of bladder abscess as well. So trocar is a sharp arrow type or needle type device which is used to drain the pus from the parts of the body. So in this case, since the patient was having a lung collapse, so what we will do, sir, why lung collapse has occurred? Sir, because the pleural cavity would have got filled with something abnormal. Doesn't matter, pus, probably pus is there in the pleural cavity. So drain the pleural cavity with the Bullock's method and prescribe the antibacterial therapy in order to prevent the reoccurrence in the patient. Next is the case of hypertensive crisis. Sir, hypertension, a woman with the hypertension, 5 years, hypertensive crisis, palpitation, pulse is this and this, arterial pressure this and this. Arterial pressure is severely high here. Hemodynamics of the hyperkinetic type, meds or drugs of choice. Sir, if we see hypertensive crisis in the patient, we may have a better drug of choice, but the first line treatment for it is beta adrenoceptor blocker. So what it will do, it will block the adrenal receptor or adrenoceptor receptors in the patient. So this is what causing the high pressure in the patient. So what they will do, beta blockers will for example metoprolol, so will decrease the heart rate and will decrease the renin release, hence the crisis can be treated in the patient. So next patient number 94, 52-year-old, disseminated vertebral osteochondritis. Lifted a significant load, resulted in the lumbar pain and pain along the sciatic nerve. Positive Lissard sign, reduced Achilles reflex. Drug of choice, pathogenic point of view. Sir, drug of choice, if there is a vertebral osteochondritis and if the positive Lissard sign or reduced Achilles reflex is there, so what we are suspecting? We are suspecting some nerve problem is over there. So in order to give the best management to the patient, what we need to do, we need to reduce the inflammation, since osteochondritis is there, itis is there. So we need to reduce the inflammation, plus Lissard sign is positive. So the patient is reporting pain on the elevation of the leg. So we need to give pain management to the patient. Here it is. We need to give the inflammation management. We need to give the pain management to the patient, which is NSAIDs. The choice of NSAID which we are using here is diclofenac, or sometimes they say diclofenac sodium. Next is 95th patient. The patient is reporting the colic pain in the lower abdomen and profuse bloody discharges from the genitals from the last 2 years. She have been having menses for 15-16 days, which is profuse with clots, painful, 2 medical abortions. History in bimanual examination shows that the canal of uterine in some fibromatous nodes and palpable 3 centimeter on the thick crust. So crust is something stalk. So this is the case of the fibroids. Sir, what are those in the uterine cavities? So there are some fibromatous nodes which are hanging with some thin crust. So this is the case of the you try fibroids. So if there is no complication over there, they can be kept in the patient. However, it's better to remove them. But what caused the problem? Uterine fibroids will not cause problem by itself, but what how they will cause the problem is if they go twisted. So when they go twisted, so they are going to cause some problem or the symptoms in the patient. Before this, the patient will not report the symptoms. So if the operation which we are going to do is here, just do the untwisting of those nodes, which will going to relieve the pain of the patient. So the operation which we are going to do is here, the untwisting of the node, and it's better to even remove those nodes. Next is 20-year-old having hemorrhages in the brachial artery. First medical aid, application of the tourniquet. So this was given in the question that first medical aid which they provided is application of the tourniquet, since the artery bleeding is there. So for the provisional arrest of the bleeding, maximum exposure of the tourniquet. So sir, you have to remember, according to the KROK question, that you can keep a tourniquet on the artery for some 2 hours, or the option was given 120 minutes, means the same. So maybe nowadays something has changed, but remember for the KROK question that you can keep a tourniquet for 2 hours on the patient. Next is the patient related to the pneumoconicosis. I have explained it in the social medicine part. What is pneumoconicosis? So this is some inhalation of the abnormal particles which will cause the respiratory problems. So this is a street cleaner who might be inhaling dust particle, probably, for sure. The street cleaner is prone to the dust all the time while cleaning the street. So what treatment you will give? Sir, we can give alkaline inhalation to the patient, because so this is the problem with the inflammation and scarring of the lungs. So sir, alkaline inhalations, which is for example, if you want the home remedies to solve some of the sputum problem or a related problem, so you can inhale a little bit baking soda, not the baking soda directly. The baking soda should be mixed with water, and the vapors can be inhaled like with the very very lukewarm water. So a little bit of vapors you can inhale in order to solve the problem with the lungs primarily. So what it does, sir, sir, it will soothe the airways and clear the mucus from the lungs. So if you are having problem with the mucus as well, you can try taking mucolytics, and one mucolytic per day, and the alkaline inhalation. So they are going to solve what, sir? They are going to solve the problem of the mucus in the patient. So due to the dust exposure, the patient got a lot of sputum in himself. So this problem can be solved in the alkaline inhalations, can solve the case of pneumoconicosis. So you can use some home remedies for mucus solution, or which is baking soda. And if you are living in Poland, you can take the ACC mucolytic agent, which I have tried by myself. This is a good agent. You will not see any kind of sputum associated with smoking induced, or associated with any other problems. So you can take this acetylcysteine 600 mg tablet, one tablet per day. So this I have taken and tried by myself. So this is a good solution in Poland for the mucus. So this is a mucolytic. Next patient says about the history of bronchial asthma, got stung by bee. So he is already having asthma, and we know that now if he got stung by bee, there is a chance for the severe allergic reaction or severe anaphylaxis. Chest compression, breathing shortage, difficult expiration, sense of heat in the upper body, dizziness apart each convulsions, noisy wheezing breath, arterial pressure is low. Okay, he is already having that severe anaphylaxis reaction now. Hypotension, tachycardia, weak rhythmic heart sounds, rough respiration over the lungs, and sibilant trails. So sir, this is the case of a severe allergic reaction due to stung by bee, and this is the anaphylactic reactions are immune mediated. So what you will prescribe to the patient, sir? Immune suppression. What is the best immune suppression nowadays? For immune suppression, according to KROK, which we are giving is glucocorticosteroids. Here is something written. What is written? So hydrocortisol, methylprednisolone. hormone suppress the immune system, reduce the inflammation and edema in the airways. So seems to be the best treatment here. Next patient is having diabetes mellitus for 15 years. Objectively heard sounds are this and this. Diabetic shock over the aorta, diastolic shock over the aorta. Arterial pressure is severely high till mark the crisis. In urine, this and this findings. Daily loss of protein with urine is 1.5. Sir, this is the case of hypertensive crisis in the patient with diabetic mellitus. You can read the profile once again, but we need to prescribe what to the patient. We'll prescribe the ACE inhibitor to the patient. Sir, what the ACE inhibitor are doing? So ACE inhibitor, for example, enalapril or lisinopril will do what? Sir, they will reduce the BP of the patient. Sir, how they will do? Sir, they will cause vasodilation. It will be reducing the BP of the patient. It will decrease the proteinuria of the patient. It will reduce the glomerular filtration rate for a while, and it's the best for the renal protection. Next patient says about the acute transmural infarction. This is the case of MI. Okay, progressing dyspnea, dry cough, respiration high, heart rate high, arterial pressure severely low. So enough to mark the cardiogenic shock. Heart sounds are muffled, diastolic shock over the pulmonary artery, medium moist trail in the lower part of the lung on the right and left. So drug at its first place. Sir, first of all, the patient is having cardiogenic shock, and it will be very painful for the patient. So what drug of choice which you are giving in the patient for at first place? Sir, first of all, we cannot see the patient in pain. We are going to give pain management to the patient. The best pain management in this case is promidol, which is an analgesic. So this is the case related to the acute left ventricular failure associated with the cardiogenic shock, since the moist trail are there in the lower part of the lungs, in the left as well as right. You know about the mnemonics of the which edema will be there in which ventricular failure. I have seen it, or I have told you about this. So promidol is the best analgesic here, so for the pain management. Let's see next patient. Next patient says about the diffuse toxic goiter, plus he got ciliary arrhythmias nowadays. So sir, for the arrhythmia which we are going to prescribe is beta blocker. When we see the abnormal heart rhythm is there, we are going to prescribe the beta blockers, non-selective beta blockers. So what beta blockers will do? Sir, they will reduce the heart rate, they will control the arrhythmia, they will control the blood pressure, they will reduce or normalize the BP of the patient. And what is diffuse toxic goiter here? Diffuse toxic goiter is the background of the patient given in the question. So overproduction of the thyroid hormone, or let's say the hyperthyroidism or severe hypothyroidism. Ciliary arrhythmia I have written here in the arterial fibrillation. What is this? Arterial fibrillation case, which will increase the due to the increased sympathetic activity of the. Let's see the next patient. The next patient says that 3-year-old child inhibition of tendon, periosteal reflexes, corneal reflexes are preserved. The pulse is rapid and weak, and arterial pressure is severely low, probably due to the decreased sympathetic activity of the patient, and suspected is accidentally took some tablet. So we suspect that the patient would have since you know that child can do this, so the patient would have taken some tablet which was lying somewhere probably, or did something. So such clinical presentation are typical for the intoxication of what? So sir, in the question, in the first line it is given that so porous state. Sir, what is this state? The deep sleep state. So next is meiosis, which is constricted pupils. And so reflexes are reduced, arterial pressure is low, so decreased sympathetic activity. So these are the characters, or these are the clinical presentation for the intoxication of tranquilizers. So when the patient will take tranquilizers, so side effects will be decreased reflexes will be there, decreased sympathetic activity as we see the BP of the patient. So this is the side effect related to the tranquilizers. Next patient says the farmer heard the right food contaminated wound 5 to 6 centimeter. Treatment, sir, we suspect tetanus in this case because the farmer would be using the metallic device in order to do something with his soil or something. We will make the injection of tetanus anatoxin plus anti-tetanus serum because there is no history of the vaccination is given in the question. So we will give the injection of both to the patient. We will give the injection of tetanus anatoxin plus the tetanus anti-tetanus serum. Next patient is having the history of diabetes mellitus, who is going for laparotomy right now. So prescribe the short acting insulin for the surgical cases with the patient history of diabetes mellitus. We have talked about such questions. So next patient says about the left sided pylectasis, which is the dilation of the renal pelvis. So such studies, deep infusion, urography, cystography and USI allowed to reveal initial hydronephrosis. No info about the secondary pyelonephritis. So there is the case that no secondary pyelonephritis is there, but we are suspecting it in the patient because of this left-sided dilation of the renal pelvis. So sir, what you can advise to the patient or what tactics you are going to use? Sir, we will prescribe 6 months. Every 6 months the patient should get the USI done again and again with the so that we can check if the pyelonephritis or secondary pyelo is developing in the patient, so that we can prevent it better. So 6 months surveillance will be good for it. That for the 6 months we are going to monitor the patient. What is here? Mild initial hydronephrosis, but no signs of secondary complication yet. Pyelonephritis and UTI. So it will autocorrect when the child will grow, because the size of the renal pelvis is going to get improved as soon as the patient will show the growth. So next patient, we have talked it in the Cone syndrome. The primary hyperaldosteronium is the case of in these cases we are going to prescribe spironolactone to the patient, which is a mineralocorticoid receptor antagonist, which will block the effect of aldosterone. So our electrolyte imbalances can be corrected by this. So you can watch my video over Cone syndrome and adrenogenital syndrome. Next is the similar case which we have seen before. So treatment of thrombocytopenia. Sir, thrombocytes are destructing where? In the patient, the given is severely low. 150 to 400 something is a good range of platelets. Sir, they are severely low here. Sir, where are they getting destructed? They are getting destructed in the spleen. So we have to do the splenectomy, because the primary site of the platelet destruction is spleen. So this is not the cases of thrombocytopenic purpura, all right, because another symptoms are not there. Or maybe it can be related to the thrombocytopenic purpura, because multiple bruises are given, nasal hemorrhages are given. Howsoever, the case is related to thrombocytopenia in the purpura. Dotted hemorrhages in the patient in the torso will be given. So this is the case of thrombocytopenia, because the thrombocytes are getting destructed in the spleen. So that's why we are going to do the splenectomy, which is primary site of destruction for the platelets. So let's see the next patient. Next patient says about the complete dissociation of the P wave and QRST complex. So this is the case of third degree block. You can watch my video over it. So what we are going to do as a treatment? So nothing given in the question, that the severity of the patient is not given in the question. So what you are going to mark? You are going to mark the implantation of the arterial pacemaker. Sir, why? Sir, patient's condition are not given in the question. If the question tell this to you, that patient condition is this and this, what is the emergency tactic? So go with the electrical urgent cardioversion. But in this case, no condition of the patient are given. So the patient the examiner want to ask about the good and best treatment for the this case. So we will just implant the pacemaker. Next patient says about the massive bleeding, a car accident, acute pain and bleeding in the middle third of his right thigh, wound anterior surface of right thigh, massive bleeding. So massive bleeding in the So which artery? The femoral artery is involved here, in the middle third of the thigh. So in the middle third portion of the thigh, you have to remember it from the anatomical portion, that in the middle third of the thigh, which artery is going through there. So femoral artery. Also the question highlights that massive bleeding. So massive bleeding will occur from which artery, sir? So this will occur from the femoral artery, because the femoral artery have a very high pressure or of the blood. So what we will do, sir? Best first aid will be digital occlusion of the femoral artery. Tonic wet may not solve the problem in the cases of femoral artery, but you can try. If there is no another option, you can try with the tonic wet, but I guess it's not going to help the patient a lot. Next patient says that sharp abdominal pain, irradiating to the right scapula, vomiting, rheumatoid arthritis, objectively pale skin, and arterial pressure is low here, pulse is low here, abdomen in the last lane it is written that positive symptoms of peritoneal irritation. Sir, we have to somehow go for the surgery. Doesn't matter what history is given in the question. This can be the case of peritoneal irritation. Cases are can be solved by only surgery. So we have to open the abdomen and get the best treatment for our patient. Next patient number 142. Next patient had some drank some fizzy drink, and which gave her a feeling of pressure in the throat. Lip got swollen, edema got there, and whole face laryngeal breathing become difficult. So sir, this is the case of angioedema or Quincke's edema. So you know about the basic aid of Quincke's edema is corticosteroids. Let's see the next patient. Next patient is mother is Rh negative, father is Rh positive. Antibodies to Rh were not found at the 32 weeks of gestation, and the redetermination of the Rh didn't reveal at 35 week of pregnancy. However, they suspected that the case might be related to the Rh incompatibility, but they still couldn't find any antibodies related in the fetus. So risk of Rh compatibility, hemolytic disease of newborn. So what you have to do is go for the checkup once a week. It will be good if we detect those Rh antibodies early in the patient, because the risk factor is there. So if we detect them early, the best treatment could be provided to the fetus as well as to the mother. Let's see the next patient. Next is the case of paroxysmal ventricular tachycardia. Lidocaine is the old treatment. Remember about it, guys. If in the question amiodarone is given, go with the amiodarone and no need to mug up with this one. So the last thing which I wanted to tell in this one, in the management portion, congratulations if you have made it till here. So let's see the last thing. I have collected some short infection treatments for you. In the cases of anthrax, according to the KROK, you are going to give penicillin to the patient. In the cases of epidemic typhus, remember you have to mark doxycycline, and in the cases of chlamydia, you have to mark the macrolides. We made a mnemonic over it in the chlamydial portion, CM. So CM is the, or AP, arterial pressure, is the mnemonic for anthrax, penicillin. Epidemic typhus, doxy. In the cases of pneumonia, amoxy. In chlamydia, CM is chlamydial infection, so prescribe macrolides. In the cases of trichomonas, when you see in the question, so prescribe metronidazole. So this is it with this video. I hope all of the things are clear now, and if there is something, let me know in the comment section, and see you in the next video. Enjoy your weekend, take significant breaks from the study sessions. Have a good evening.